Reagan Robertson here with Productive Dentist Academy. Get ready to join your favorite podcast hosts, Dr. Bruce B. Baird, Victoria Peterson, Dr. Chad Johnson, and myself, Reagan Robertson, at the nation's #1 dental business course that guarantees practice growth. That's right, full immersion CE, so you can consistently produce more and align your team for results without compromising excellent patient care. Registration is now open. The tuition cost is $2,195, which is ridiculous because it's regularly $5,528. Hop on over right now to www.productivedentist.com/workshop to grab your registration today. Again, that is www.productivedentist.com/workshop. If you cannot wait and you have to have it right now, email Brent, B-R-E-N-T, at productivedentist.com. That's Brent, B-R-E-N-T, at productivedentist.com, and we will save you a seat. I look forward to seeing you there. Welcome to the Everyday Practices Podcast. I'm Reagan Robertson, and my co-host, Dr. Chad Johnson, and I are on a mission to share the stories of everyday dentists who generate extraordinary results using practical, proven methods you can take right into your own dental practice. If you're ready to elevate patient care and produce results that are anything but ordinary, buckle up and listen in. As a business owner, you're responsible for being the architect of change in your practice. In order to be that architect of change, so you can be the best advocate for your patient, you deserve access to the latest resources and information that you can bring to your team to elevate patient care. That's why today, Chad and I have a very special guest today. Check it out. This is a heavy hitter that we have in store. Chad, are you excited?
You better believe I'm excited.
Our guest today is a founding member of the International Associate of Ozone in Healthcare, founder of the Lifeguard Approach, and former oral wellness liaison for the Bale-Donine Method. Dental hygienist, patient health advocate, and wellness coach Cris Duval follows the science today to deliver the latest tools, methods, and communication required to get patients the healthiest outcome possible. And that includes the well-being of your practice too. Cris Duval, welcome to the Everyday Practices Dental Podcast. We're so glad you're here.
Yay.
Thank you. This will be fun.
Yeah. So Cris, we all go back a ways. We've had you at productivity workshops in the past. We know that you've developed a wellness program since 2001. You really are the authority on thinking about being the architect of change in dental practices in relation to hygiene specifically. But right now we have a problem in hygiene. What are you seeing right now going on in the dental world?
Well, I'd like to broaden this out besides just hygienists, because this is a dentist problem also. And first and foremost, I think it's a dentist problem. So, it's a trickle-down effect from the dentist to the hygienist and the rest of the team. So I'm excited to talk about that.
And it even goes bigger than that, not to pass the buck, because I agree. But then it goes into integrative medicine altogether with the community of healthcare providers. And I see that you've had a history with Bale-Donine, and I'm getting plugged in as a patient with Bale-Donine stuff. So I just you'll think it's kind of funny. I actually did my own blood draw yesterday and sent it off.
Did you just say you're getting in with Bale-Donine yourself as a patient? As a patient,
yeah. So Dr. Gina Pritchard down in Dallas is doing my healthcare for the last year. So I'm dialing that in. And that's been fascinating. I want you to know, Cris, we talked earlier, but just for the listeners' sake to catch up to this, I have been a fan of Ozone for a while now, and I was at first fascinated by it and started then pursuing it heavily when we got hit with COVID. And I wanted to, address some of the safety concerns and health risk management through Ozone. And so I had gone to an Ozone class actually just November, September before COVID hit. And so it was within 6 months that I was calling the factory. I'm trying to think of the ozone manufacturer. I'll think of it later, which is unfortunate. In Canada, that made the ozone for me, and longevity ozone generators, and got some of that started. But it goes back even further when I was having Productive Dentist Academy, when I first brought them on, which was about 8 years ago. Talk about what does my perio program look like, and the evolution started with, we want to, in essence, just to, when we were talking about, what does it look like when you're helping establish patient care and a science-based evidence, with dentistry, just to catch people up. When I'm doing that, at first it's, we're scraping teeth to get them clean. And then later on it becomes, wait a second. Okay, so we want to disrupt the biofilm. And so cavitrons are good because it's, going down. And a lot of dentists kind of just stop there and go, well, hopefully we can check your bleeding. And we've lowered the pockets a smidge and we've lowered the bleeding a smidge. But I guess my pursuit went deeper into figuring out, okay, how can we do better? And how can we be better than the average dental office that's doing 1 or 3% perio, and get that number up? Because just 1% perio is atrocious, but it's kind of the average. What have you found when you're talking with dentists?
It's very low. Their perio percentage is low. And just to give you an idea of what mine was I tracked it, and the statistics about the amount of the population that suffer from periodontal disease is very high. It's predicted that 80% of the population show evidence of periodontal disease.
And keep in mind, that's the American Association of Periodontics. So, like, when you give that quote, you're not just quoting some obscure, science. It's just like, no, that's the AAP.
That's from the experts.
Correct.
So that's when I realized that. And that's when I decided I've got to listen to the experts, because what I've been doing isn't good enough anymore. So along with that mindset, and then Dr. McKay taking me to lunch at the first week that I worked for him. And I want to tell you, this is not what he said to me, but this is what I heard. Okay, do you understand the difference? Okay, so
interpreting the message.
I heard, I want you to develop a wellness program for me. I want you to develop a way for patients to come back and see you when you're healthy. I'll give you continuing education, the technology that you need, and a personal coach. That's what I heard. And so I took off from there, and I knew he would walk beside me and guide me and help me, but he truly empowered me to have an impact on patient health and on the practice, because let's face it, the dentist can't be everywhere at all the time developing protocols and telling the hygienist how they should be running that part of the practice. It gave me such empowerment, and I was so enthused because I was going to get an opportunity to use my intellect and my judgment and my the way I approach patient care. It was so freeing and so exciting that it just took off. And so I'd encourage everybody to somehow figure out a way to give your team members, not just your hygienist, but your dentist, give your team members a challenge, flip your leadership role in your practice, and try and create leaders in every department of your practice and have them connect as to how can we better overall as a patient as a team take better care of our patients. Because let's face it, we want you, Chad, in the chair doing what you do best. And that's not necessarily managing your hygiene department or your assistants or whatever. So
That's right. For example, in my practice, once a month, the hygienists go to lunch specifically to have a hygiene departmental meeting where they can talk about only hygiene matters and problem solve themselves to get to a solution. Now, if they need my help or they need me to, facilitate something to help them do better, then they'll let me know, but they own it.
right. Yes. So back to what we had originally discussing about low perio percentages. The perio percentages in Dr. McKay's practice coming out of the hygiene department averaged between 78 and 82% of the codes or the procedures that came out of my hygiene department were perio related codes.
That's
So
fantastic.
you can imagine, and people say, well, you must have been selling dentistry like crazy. I only gave patients what they wanted. These were procedures. Our patients chose this level of health and wellness. It really had not that much to do with me other than my approach.
You weren't twisting their arm. You were simply guiding them to make healthy choices. And sure enough, they naturally, by and large, were choosing the healthy choice.
Right. So what I did, I could not go in and talk to a patient at all. You'd have to put a 3-inch piece of duct tape over my mouth unless I knew the answer to one specific question before I went into an operatory. And that question was, tell me about what you want for yourself. Because once I knew that, what they wanted for themselves, all I had to do was step in the gap that was created from where they were that day and where they wanted to be. And so asking that question is a profound and important part of shifting your hygiene or your whole dental practice to increased health and wellness. And that's a great question for dentists to be asking too. We just make assumptions that we know what patients want. We know very well what patients need, right? But there's a big difference between need and want. Huge difference.
Well, so, and another interesting thing is just because you've identified them and you've treated them doesn't necessarily even mean though that the outcomes are going to be better, because someone might be great at, and I'm just being harsh for a minute, someone might be great at getting patients to be like, yeah, no, I want to do better. For example, someone that's got a 1970s model of hygiene could all of a sudden start implementing, so tell me what you want for yourself. And they answer and they go, well, I just want the healthiest mouth possible. And they go, okay, well, we're going to scrape even lower. Exactly. And it's just like, so wait a second. So it's not just about asking the question. So then you had to figure out, okay, now we're getting people to say yes. Now, how do we, the tedious weeds of, how do we improve this beyond what this standard, quote, standard of care is to optimal standard of care?
Yes.
Not minimal.
Yes, absolutely.
And so how did that progression look? In under 30 minutes.
Well, that's, when I started listening to the experts, as I said, and I started really thinking about that gap that was created. I wanted to make sure I was choosing the best things to recommend to the patient to close that gap. And that's when I realized there was such a mismatch between how we were taking care of patients, scaling and root planing, or, prophies and polishing, to the fact that the science was telling us that what's going to impact your patient's health and wellness most is helping them create a healthy biofilm. I mean, you can scrape all day long and have them come in every few months, but you're not going to have the profound health impact that you will get if you start focusing on biofilm health. And so early on, we started doing bacterial testing. I was there when Tom Neighbors introduced oral DNA at the Chicago Midwinter meeting. And
wait a second, I might be a little too young. Is that where you get the Neighbors probe from?
no, I don't think so.
Okay, I was trying to put a reference to the name. Sorry, that's all.
Yeah, he literally started oral DNA, the bacterial testing for the high risk pathogens,
Got it.
and now he's got a new one out called High Risk 5, HR5. But I just get so enthused when I see the difference in the change that can happen when a practice will start developing and matching their protocols. Well, first of all, their mindset and their messaging, and then their clinical habits, matching those to what the science is telling us today. And that's listening to the experts and, really just getting out there and deciding to make that shift from merely repairing the damage and what was going on with patients to preparing patients for health. And what happens, what I found and what I termed it is my patients shifted from living in what I call the danger zone, because so many of our patients are in the danger zone and are at risk of having catastrophic events happen and even death. So I was so focused on shifting them from that danger zone to the safety zone. And that's that zone where the immune system can balance the bacterial load. And that results when you have a healthy biofilm. It just reduces, we know those high-risk pathogens, some of them are responsible, they're causal to atherosclerosis. So what kind of an impact can we have when we're testing our patients and to see what type of pathogenic bacteria they have? And then once we know that, we're using the most effective product to get rid of those pathogenic bacteria.
Because it's hardening the intima of your cardiovascular lining.
Right.
I have a question from a patient perspective, Cris.
Mm-hmm.
There's a really important nuance, I think, when it comes to communication. For example, I always put myself in the hot seat. Like for years, I've had jaw discomfort. And I don't know if it's normal or it's not, and so I do get the head and neck screening every time I go in. And I always preface this by, I have a fantastic dental practice that I absolutely love. I'm going to be more heightened than normal, I think. But I have mentioned over the years, if I have discomfort, isn't that a moment where we can train the team? So they hear that. So you're asking that question, what would you like? Or what does health look like to you, or whatever that opening question is. I think sometimes people don't even understand what's normal and what's not normal. And then once that is voiced, how does the hygienist take this to the doctor or take this to the next level? So instead of glossing over and saying, well, let me know if it's worse or anything like that, and just kind of going on with it, how do you communicate that bridge? Because I love where you're going with what would this look like to you? What would health look like to you? What do you want for yourself?
Yeah. Well, it goes back to, for me, when I would hear somebody say, if you said to me, I'm concerned, or should I be concerned about, some swelling that I have back here, my first response to you would be, tell me more about that. Because I think our big challenge in dentistry is, especially, in medicine and dentistry, is we make assumptions about why the patient is asking that question. And you just cannot make assumptions anymore about, you got to ask follow-up questions. That's the key to expanding your service mix. So when I talk about, I want to get patients living in the safety zone, what it does is I didn't see calculus anymore when our patients came back to see us when they were in the safety zone. And so you can imagine what that does to a 1-hour appointment as to how much time I had. So I developed something called 20-20-20 hygiene, which I just spent first 20 minutes is on relationship building. The second 20 minutes is on the actual hygiene portion of the appointment. But that gave me an additional 20 minutes. And here's the importance of following the science and developing your mindset, your messaging, and your clinical habits. What is most important today is our life-saving screenings. Because when I left hygiene school, I won't tell you what year that was, but basically things have not changed in the basic hygiene protocol of how we do the hygiene visit. So I was doing oral cancer screenings. One of my first patients in clinic was my husband's grandfather, and I found an oral cancer in his mouth. And it set the anchor for me that for the rest of my life and the rest of my career, I was going to do an oral cancer screening on every single patient, every time, no matter what. It wasn't negotiable, because I knew that any patient sitting in my chair had someone at home or in a relationship that loves them just as much as I loved Gary's uncle or grandfather. So that wasn't negotiable I wasn't going to not do them.
Yeah.
So today, though, because I have the time in my appointment, because I'm not focusing on calculus removal and bleeding gums, I have the time to do oral cancer screenings, take blood pressures, do carry-free screenings, use my Velscope, airway. Oh my gosh, airway is so important. That's the essence of life, is us being able to breathe and get oxygen. So there is a plethora of new life-saving screenings that we must be doing in order to save our patients' lives. And I call them these life-saving screenings, they're lifelines between the practice and the patient. And there's nothing more important than being able to use these lifelines on every single patient.
Hey, okay, so bigger picture stuff. I also want to make sure that that we're talking for those that are listening for your sake. I mean, I almost hate to, swing it another way, but tell me, for the listener that's listening right now, about how lasers help hygienists, especially in states that allow it, because there are some that are more difficult than others. So that's unfortunate, but nonetheless, dentists can advocate to their boards for these positions. And I hate to make it procedural, but I mean, what I'm saying is, how are hygienists empowered by using lasers, for example? And what does that look like? What kind of outcome changes have you seen? I threw probably 7 questions at you, so I'll just stop.
Well, I use lasers since 1999, and I use them in Dr. McKay's practice on everything I did. I'd use it to decontaminate and debride when I was doing periotherapy, but I needed something more. And the rules and regulations on each state are just so cumbersome, because some can use it to decontaminate, some can't use it to, most can't use it to debride the granulation tissue. And that, to me, is where the most benefit of lasers come. It's like it jump starts the immune system by removing all that infection from wherever in the sulcus or anywhere in the tissue. So I think they are of value. I believe that a belt and suspenders approach to perio, to anything, is always great. And that's where listening to the science comes in, is that I think we need to be using a lot more or have a lot more tools in our toolbox. And for me, lasers and ozone became probably the most important thing that I did, because it has so much more of a powerful effect on enhancing the oxygen delivery to the tissues. And that's the most important biological need.
So help people understand, because they're thinking, okay, so how do you get, what modalities do you use to get ozone where it needs to go?
I use water, ozonated water,
Okay.
ozone gas, and ozonated oils to help get the ozone. See, what happens is, if people don't know about ozone, what it does is it creates an oxidative burst. When ozone comes into contact with other bacteria or viruses or fungi, parasites, ozone's very unstable and it wants to revert back to its natural state. And so when it comes in contact with any of those objects, what it does is it says, oh, here's my chance. I'm going to break apart because I'm going to go back to where I came from. And that burst, when the ozone breaks apart, the O3 breaks apart, it creates this oxidative burst that literally blows apart the cell wall or the membrane of any of the bacteria, viruses, fungi, parasites.
Right.
So Dr. Malika refers to it as rocket fuel. And, it just is, we don't have anything else that is that fast acting and as effective as ozone is, in my opinion.
And yet it doesn't affect our eukaryotic cells of self, because the cell membranes are thicker and protect, so in other words, someone could say, well, then why doesn't it just kill us by, releasing all nuclear fission of the universe all in your mouth? It's like, well, it's specifically going after the prokaryotic and, all the germs, the microbials.
Yeah. And it's a good thing, though, to use some probiotics after, just simply because you want to reestablish more of the good bacteria after you have had done treatment on the patient.
Yeah. No.
Can you imagine?
I'm just kidding.
No, can you imagine how absolutely it's not just mind shifting internally, how mind bending this is to hear this from a patient perspective, Cris, to the I'm just pausing. Okay, Rick, take out that one little part.
Sorry.
No, you're okay. That's the nice part about it. Well, even if it was live, we would just say this is live, folks.
Yeah.
So can you imagine? Ready?
Yeah.
Go.
Can you imagine how not just mind shifting this is internally to the dental team, but how absolutely mind bending this is from a patient's point of view on all that's possible in a hygiene appointment? Can you imagine from the marketing perspective, Cris? I mean, we have been conditioned to feel like it is just a treadmill, and yep, you've got a little bleeding. Yep, you've got a little bleeding. Yep, you've got a little bleeding. I mean, we hear it over and over and over again. And are you flossing and are you brushing? And it's just kind of like your brain goes numb to it. Yes. And if you were to tell me that, if you were to meet me at that gate and say, I'm going to help get you the healthiest you can possibly be, and when we eliminate that bleeding, when we get to that point, we're going to start seeing less calculus. We're going to start to be able to have the space to do all of these other things to help you be healthy. I am on board and I'm willing to pay anything in order to make that happen. It's a completely different way to look at a recare visit from my perspective.
Absolutely. And the thing is that we now know that patients want one of two things. They either want to move toward the benefit of health or they want to move away from the consequences. So,
Yes, that's so true.
yeah. So the only thing you have to do is you have to develop your messaging, because how you are going to treat these patients clinically is exactly the same. But you want to frame your messaging in a manner that they can buy into it because it's what they want. So, if I knew somebody was that wanted health, I would talk very differently to them than I would to somebody that wanted to avoid the consequences of getting a swollen face like his brother did. So it's all in the pre-framing, and that's why I don't really I like to use the word messaging instead of communication today, because what's important, Malcolm Gladwell in The Tipping Point says that you need to have three things in order for something to catch on. And now those three things it has to be personal, it has to be practical, and it must have a sticky message. So what I did, the first time I came back, when I had what I needed to start using Ozone, I started out Monday morning and I said, how we have taken care of you in the past just isn't good enough anymore. And so because of that, this is how I'm going to take care of you today. Hold on here just a second. This is how I'm going to take care of you today. Here is why I'm doing it this way. And this is what it means to you. So those were those three parcels that Malcolm Gladwell feels so important.
It's the why that's so important to me from my perspective. So I've had hygienists in the past switch up their routine. Some of them have explained it and some of them have not. And I feel like it's such a missed opportunity to not explain what's going on and why it's being done in a certain way. Chad is really, really good at explaining why we're going to do what we're going to do, what he looks at, how this is important. So he's telling a journey and a story with that. And that's exactly what I just saw you lay out there, Cris. We have to be able to get the patient on board and understand why this is, the way that it is, and how the hygiene department these days are so competitive. I think I'm seeing it all over the message boards. So giving them these resources and tools and tying the doctor in, like you did right at the beginning of our podcast. You said, this is not just about hygienists. This is about the doctor too. Doesn't this lead itself, Chad? I guess this is a question for Chad. Doesn't this lead this conversation into the co-diagnosis realm?
Yeah. And like when I think about my team, I explain to my team, a new person, here's how we're going to do stuff. And I want you to be understanding ad nauseum almost why we're doing what we're doing. So that way, I've explained to a new assistant, for example, recently, I said, that was a really long answer, but I wanted you to understand why I was choosing and what I was thinking about while I was choosing to do one or the other. So that way, over time, you can know, as opposed to I could have simply told you, we're going to choose material X. But I want you to understand why we're choosing material X over Y, when we would use Y, when we would use X, when we shouldn't use Y, or when it doesn't matter, and stuff like that. It gave her a context. So that way, over time, she can have wisdom to apply why she's going to choose something, and then she can actually read my mind. And I love the compliment that patients give when they go, you guys didn't even say anything there. And it's just like, yeah, because they know what my decision tree is, and I've communicated that with them, or Cris, I've messaged that with them. But that also then, going back to your question better, Reagan, is that with the team, I come in and I a lot of times say, now I know this hygienist is like Carrie, for example, I know Carrie has already explained this to you, so I won't go into much detail unless you had questions regarding that. So I don't try and really triple down on the discussion of it much, but I acknowledge that basically what they said was right. And surely you heard that. And if they say, oh, I don't get this all too much, if ever, well, I kind of wanted to hear it from you. I mean, maybe, but most of the time, if I empower the hygienist, oh, here's another one, Cris, that you'll really like, Regan, along these lines too, is with a new patient, I'll say, listen, you've got 5 teeth that we need to do, fillings on. And I could show you where, if it really matters to you, but there's 5 spots on the x-ray that I found. And, earlier, they probably showed you where these spots were. And so, you already know about that. But I don't want to fix these just yet. I don't want to address that until your gums are healthy. So when the hygienist has talked to you about how we, address your periodontal therapy or your periotherapy, I want them to go through the periotherapy program with you, have your reevaluation at 12 weeks. And then if they give me the green light, then we'll move forward on your restorative work. But I don't want to work in a bloody mess. Just a minute ago, I explained to you, listen, I don't want.
Do you say that, Chad?
Yes, I do.
You say, I don't want to work in a bloody mess. I like the visual of that.
Thank you. That would go along with Gladwell's idea of having it be sticky, right? But I explained to him, I actually, this is very Bruce-esque, Regan. I'll say.
It is very Bruce-esque. I've heard him say, but I've heard him say very similar.
You don't want me to put a filling in where it's not clean.
Yeah, no.
I want to be able to have the gums be healthy, because I can't have water in my restorations. I need it bone dry, but I also can't have blood and spit and stuff like that. So we need it to be perfect. In order for it to be perfect, Shonda, the hygienist, is going to work with you on getting your gums healthy even before we've begun on the restorative work, because I don't want the fillings to fail in 2 or 3 years. I just don't, unless you're up for that. Obviously, who is? No one's ever agreed to that. So now that we're in agreement, let's get the gum health just right. When they give me the green light, then they'll start scheduling you for the restorative work.
Yeah. So going back to, thank you for that. But going back to when we're talking about, investing in your team, and one of my biggest joys comes when I was able to say, when Dr. McKay hired me, he promised to invest in me on your behalf with the skills and training needed to help you get what you want. And that's why I think that this is so important, of matching our protocols to the science out there today. And,
I was going to say, that's a great segue into the Ozone Therapies Group and Frontiers in Ozone event.
Yeah.
I think that really connects us. Can you tell us a bit about this upcoming event?
Well, I've been to 5 of the 6 events, and it is such a rich resource for learning from the experts, the latest out there that we know about ozone. And they keep finding more and more information out there for us to help our patients get healthy. And it's a rich resource. There's collaboration, there's social events, and the speakers that are there really, they stay the whole weekend and they're engaged, and they will engage with you in a great conversation, over a glass of wine in the evening or wherever it is you might want to get some more information and make a connection. It's going to be in Scottsdale, right in my backyard, which will be fun. It's November 3rd through the 5th. And if you would put the link where they can go to and check out the speakers. And one of the things we're now developing, because I'm co-chairperson of the conference, is that the lifeguard approach is going to be having either a half day or pretty much a full day workshop on exactly what we've been talking about today. Because what's most important, I think, is for dentists and their teams to develop a strategy of what they're doing and why and who they're going to be for their patients. And those strategy questions are so important to answer. Why are we doing this? And then after you've got your strategic questions answered, ask yourself 5 tactical tools, because all Ozone is a tactical tool to help you get what you want. So you're going to say, what are we going to do? When are we going to do it? Who's going to do it? How are we going to incorporate Ozone into our practice? Those are just merely tactical questions to help you get what you want. So, and
Cris, I've got a question. Let's back up the horse. Let's say someone has gone this far in listening to us because they're interested in this topic, but then they said, but the ADA doesn't even say that that ozone is efficacious at all. Like, how do we even know? So how is ozone so effective and yet also so contrarian?
Well, I have my own opinions. And
if it gets too risque, we can cut this out, but I'm curious to know your opinion.
I think it's the impact of false information out there. The drug companies do not like ozone. It's cheap. It's easy to use. Ozone's been used for as far back as World War I.
Tesla had a patent on it.
Yes. So it's not new, but people like to poo-poo it and discount it. And there's certain people that have a challenge with somebody if they're selling ozone equipment across state lines and aren't following the rules in that manner. But you as a dentist have every right to purchase ozone and an ozone generator and be trained safely in the use of it. And you can make that decision as to how you want to take care of your patients and what the benefits are. It's not up to other people as long as you're not doing anything illegal.
Well, I want you to know, originally Barclay Bastian over in Maui, I was looking at his practice. This was 8 years ago, something like that. And so this was when I first got introduced to ozone. I walked into his office and I said, why does your office smell so clean? I've not smelled. Now, this is also in Maui when everything smells earthy. Okay, so it can almost be, because there's so much rain and stuff like that, it can almost in an indoor smell musty. But there I was like, why does your place smell fantastically clean? He said, well, actually, I'll tell you, but we use ozone. And I was like, what do you mean you use ozone? This was new to me. This was after 10 years of being in practice. And he said, well, let me show you. And he then gave me also a little sample jar of Pure 03. And that night I put some in my retainer. And the next morning, my retainer was still fresh. And I was like, we're on to something, because that's amazing that my retainer listen, for the listeners, my retainers always smell fresh, whether I use ozone or not, because
Sure.
I'm just flowers and daisies. But maybe other people might find that their retainers are a little bit gross, but I was shocked about how the ozone would, in essence, it was naturally disinfecting. So that's when it started, Cris, to check into this. It was a trip to Maui. And I should write that off as a business trip, doggone it.
Yeah.
But I was fascinated by it. But I was curious what your thoughts were on why Ozone just gets, no offense, Reagan, to be the redheaded stepchild of, the dental industry, not really the science industry, but the dental industry, even the CDC and the FDA.
Well, we know the reason there, don't we?
Well, yeah, I mean, but I thought, I wanted to at least broach the subject for
Yeah.
listeners that are going,
Yes.
well, I don't see science-based evidence, but the fact is it's out there. You just have to find it, because it is poo-pooed by big farm, little farm.
This is what's so frustrating to me, Chad, that I think it circles back, Cris, to the very start of our conversation. We need to ask better questions.
Yes.
We need to ask better questions as clinicians, as patient health advocates, and as patients ourselves. So that there comes a lot of bravery with that. I think
Yes.
that is history has proven time and again that it's not always encouraged to ask questions and step outside the boundary like that. So it is, I can tell you, definitely I've heard answers for my own health. There can be nothing done about certain things, inside or outside of dentistry, just nothing can be done. Well, if I switch the way I ask the question and I look to integrative healthcare providers, guess what?
Mhm.
There's plenty that can be done.
Yes.
And plenty that is done, but we have to know what to ask, and we have
Right.
to be advocates of our own health. So I think what you're sharing and the message that you're sharing requires a bit of bravery, and it requires critical thinking.
And thank you for that.
And I can tell you, I would love to tell you my own experience with something beyond ozone in the mouth. I have been a patient of Amy Doneen's for over 10 years. And we've always had a challenge getting my C-reactive protein down to a level where she was really happy with it. And it wasn't anything routinely high, in my opinion. It was 1.1 for C-reactive. And she said, I want it down to 0.5. And the other thing was my lipids, my cholesterol was slightly high. And she wanted that, just due to the inflammation that's created. She wanted that better. And my things like myeloperoxidase and F2-isoprostine and my histamine was elevated up to around 13 point something. So anyway, I was introduced to a woman that does a procedure called EBU, and it is extracorporeal blood oxygenation and ozonation. It is exactly the same as dialysis.
In America?
Yep.
Oh.
So, and there are lots of places that are.
I don't even know what just occurred right now, but because Chad's excited, I'm really excited.
Okay, so listen to this. So I had my call last week with Amy on my labs, and I had run my labs 3 months ago. So it was in March, and then I ran them again, a couple of weeks after doing this EBU. And I was totally amazed. I thought it was going to happen, but so Amy gets on the phone with me, and after she says hello, the first thing out of her mouth was, "What have you been doing?" She says, "Your labs are perfect." And I said, "Well, I'll be happy to tell you if you're open to a little bit of, maybe non-traditional type of treatment." So my C-reactive, I've done EBU 3 times. And just for your own curiosity, I'll send you guys a couple pictures of me doing that. But my C-reactive protein went from 1.1 to 0.5. My cholesterol went from 215 to 175. My histamine went from 13.9 to 6.9. My my myeloperoxidase, all those numbers were just perfect. And the great thing about the person that did this EBU for me, she's going to be at the Ozone conference. And she's on the workshop day. She's going to be doing some EBU on some patients, people that are attending the conference. If they want to have that done, they can do that. So there is lots more than just traditional. There's lots of dentists that are going to be speaking on ozone. Phil Malika's going to be there. I'm going to be there.
Yes.
And a bunch of other people. Just go to the website. We're constantly updating it and constantly adding content to it. And it is, I think, the conference to be at if you want to have the opportunity to figure out how to better match your protocols in the dental office to the science. Because, we now know that your white blood cells produce ozone when they're fighting an infection in your body. So how cool is that? So, yeah.
All right. So I've got a tangible question, because I like posing this with, different clinicians, colleagues, stuff like that. Someone comes in and has 100 bleeding sites. Traditionally, with SRP, I don't know if this is good or bad, but if we got it down to 33 sites, so if we cut 2/3 off and still had 33 bleeding sites, I'm talking old school, SRP, just, and I'd be like, oh, well, we improved it. And I would have been happy with that. When we switched to laser, I found that we cut those 33 remaining sites in half. So we went from 100 of this arbitrary example, bleeding sites, and we cut it down to 16 or so. And if we had more than that, I'd be like, oh, we should have been able to do better than that. You get where I'm saying? There's that successful. I've not done a good job at tracking how our ozone in the water system has helped, and when we do pre-rinse and ozonation and stuff like that. But if someone is using ozone, what would be your number? No, in your protocol altogether, ozone, laser, magic sauce, whatever you're doing, how you're talking to the patients, everything comprehensively. If someone had 100 sites and they came back and they had 10 bleeding sites at their re-evaluation, would you be satisfied initially, or would you be like, oh, that's disappointing? What's your number?
0.
Doggone it, I was afraid you'd say that.
So there is a website by one of my mentors in ozone who I first learned about ozone through, and I became part of his teaching cadre, and his name is Dr. Phil Dome. And he has a website that's called ZT4BG, and it stands for Zero Tolerance for Bleeding Gums. So if I have a patient that we treat, and let me tell you what I tell them when I send them out the door, say on their last therapy appointment. I say, I'm turning the healing process over to you. Hold on just a second. I
like the pregnant pause there, because
hold on, my computer, I just lost you guys.
No, you didn't. We're here.
Well, I know, but I can't see you. I guess.
Forget that. You're throwing down too many good things, teacher.
Okay. So I say when I walk them out the door at their last therapy appointment, and by the way, please call it periodontal therapy, not quadrants of scaling and root planing. I know you use the same code, but we are trying to shift the insurance company and their thoughts and beliefs about what we do. So as you're walking them out the door, I would always say, I'm turning the healing process over to you. I have done all I can this next part of your healing is up to you. So let's see what you can do to help enable your body to heal. You know, we're just trying to get the body to heal. If we use the right things, like adding oxygen, which is the most important component of healing of the body, we just need to add oxygen and whatever the body needs and get out of the way and let the patient with their own body create the healing.
Yeah.
So I would, so then also when they came back for their 6-week therapy appointment, I would always tell them too, let me back up a little bit. On that initial appointment, when I'm doing therapies, I would always tell them, when we gave them an estimate of the investment to get their gums healthy, I would always tell them, I have no idea how your body is going to respond to what we're going to do. We know that the healing response should be great, but I'm going to leave my recommendations as to how many therapies with you, I'm going to leave that open-ended, because it's like, I mean, this is what I say to him. It's like these first therapies, I put out a major forest fire. And when you come back and see me in 6 weeks, I'm going to look for any hot spots.
Smoldering.
That are still smoldering. Yes. Yeah. So that's, you know, the things that I tell them. And
I think this is important for listeners to hear, because I think most people would be satisfied with 30 out of 100. And I'm just saying. So I asked the listener, what's your number? Because you've got a number out of 100 that you'd say, oh, you know, that's good. And I hope it's not 50 out of 100, you know, but if your number without some of these modalities that we're talking about is 0 or 5, or let's say you're even beating me, my number seems to be about 16, where I just go, okay, we're, you know, like we're, I'm not saying like that I'm done or we're all good, but I'm satisfied with that. Like, you know, that's not bad. So what you're doing is, even on this podcast, you're pressing me to figure out, how do I get it from 16 even better? So I asked the listener rhetorically, because you're just listening right now on the drive, whatever, in the shower, what's your number and how can you get it better? Because wow, 0 tolerance for bleeding gums. It sounds a lot like the, you know, 0 bone loss for implants kind of a concept, which is a big thing for implants, but it's for natural implants, your own roots.
well, I have a quote, and this is a Cris Duval quote. Ignoring clinical evidence for whatever the reason opens the door to a catastrophic, well, hold on, I get it mixed up sometimes. Can you just stop for just a second and I'll give you the exact
we'll just
quote.
we'll just redo it.
Okay. Hold on.
And while you're looking that up, let me just say, and then I'm done with pressing questions.
They don't bother me.
No, I bet not, but I'm just saying my brain is full and I'm done.
Oh, okay.
I'm not saying you're done. I'm saying I'm done.
Hold on here just a second. Okay, here's the exact quote, and you can credit this to me. Overlooking or ignoring clinically based evidence for whatever reason can have a catastrophic impact on patients' overall health and wellness and open the door for disease and even death.
Yep.
So that's why Dr. McKay and I had a 0 tolerance for bleeding gum. And so what's most important in all that in all that we have discussed today is that he set the stage. He threw out the challenge, and he was so supportive of me. And sometime I'd love to talk to you guys about what I learned from him about having a question behind the question. He drove me crazy because I'd go to him and I'd say something and he'd say, well, why do you think that? Or, I'd say, you need to come and talk to this person. Her teeth look horrible. She needs a new smile. And this is when I first started working there. And he'd say to me, well, what does the patient want? He got the point across to me very early on that I needed to find out when I had my communication and when I talked to him about a patient, I always had to know what the patient wants. In fact, it was so important. I developed a wants monitor that went on the back of our route sheet so that every single team member that picked up their route slip and was preparing to work with a patient, the first thing they wanted to look at was, what does this patient want for themselves? Do I talk about them in terms of they want their teeth to look better, or do they want their teeth to function better? My best friend was in the office and I thought she needed to have her teeth, have a cosmetic procedures done on her teeth because I thought they could look better. But she only would give herself permission to move ahead with Dr. McKay as long as we pre-framed it about how her teeth would function better. She wasn't, impressed with how her teeth looked, but she wanted them to function well. That was the most important thing to her. And so she moved ahead. He did a beautiful design for her. And so now her teeth look fabulous and they function very, very well.
Yeah.
So this is the lifeguard approach. All this stuff is about who we're going to be, what our mindset is, what our messaging is to our patient. And that impacts your clinical habits of what you're going to do.
It reminds me, Regan, my first job was as a lifeguard. And I get the idea of this as guarding someone's life and, like maximizing their health. But I also, like, each time you say it, it reminds me of my first job as a lifeguard. And it would be as though if I said, how many drownings is acceptable?
Mm-hmm.
How long should I wait before the person's underwater before you go in and get them? When should we be less vigilant on keeping our eyes on the water? When is it okay to screw around and push someone into the pool? When is it okay for me to close my eyes and rest? Which parents aren't interested in having their kids be observed? It was a few years that I did that job. And I actually, for a teenager, took it very seriously. And I think that also helped me set up for being a healthcare provider because it was early introduction into, what's the main goal? Keep calm and push on, get the patient healthy again. If their airway's blocked, unblock it. If it can't be unblocked, figure it out. If their heart isn't beating, beat it for them. Stuff like that. So, and that's on a basic level, but that lifeguard is a great name. So the lifeguard approach, because I'm just thinking,
yes, it's guarding and guiding your patients with oral systemic health. And just real quickly to end this, I'd love to tell you about why I call it the lifeguard approach. When I was 14, I was a champion competitive swimmer. And we had an event at my home pool, and I swam my race and I finished well before everybody else did. So I turned around and leaned against the wall of the pool to watch the other swimmers finish. And as I did that, I blew a great big bubble. I swam the race with a big wad of bubble gum in my mouth. And the lifeguard got down off her perch, and the timer in my lane was a physician. And they knew me and had a relationship with me. And as I started to leave the pool, they both stopped me. And they asked me the question, do you want to live to be an adult? And well, that's a stupid question. Of course I do. And they said, if you had aspirated that bubblegum during the race, you'd have gone dead in the water and we would have not known how to help you. We wouldn't have known what the cause was. And that has impacted me. That's why I call it the lifeguard approach, because they could have just let me walk out of the pool enclosure and looked at each other and said, stupid girl, and let me walk off. And then I could have possibly done that again and aspirated it, and I would have been in a lot of trouble. So that's why I call this the lifeguard approach, based on my experience as a 14-year-old kid. I've never forgotten it.
Well, here's the good news. Your message, that branding, hit me. I knew exactly. Isn't that cool, Cris? Yeah. I followed without you even saying it. That was a fantastic story. Thank you.
You're welcome.
All right, so now I need to know, what did you swim?
I swam everything except I was not good at breaststroke, so I always had to have a great lead. My butterfly, my backstroke, and freestyle was super duper. And if you look at my website, CrisDuval.com, you will see a picture of me with one of my swimming trophies.
No kidding.
Yeah.
Oh, there it is. I'm looking at it right now. How cool is that?
Yeah. And that was in Spokane, by the way. I swam in junior Olympic events, AAU sanctioned events.
Wow. Cool.
Yeah.
Well, Cris, we have been honored truly to have you on and talk through these difficult and contrarian subjects for the patient's benefit. So I hope that people got a lot out of this, that they can take, and there are tangible nuggets in there of what they can do to proceed next if they want to, get their patient the best health that they can.
Yeah. Come and see us at the Ozone conference. I'll be there, and I'm happy to spend time with any teams. Bring your team. Don't be one of those dentists that comes by himself and then thinks he's going to go home and implement that by himself into the practice. He needs his team leaders to, enable the team to really embrace what it is he wants for his patients, or she. So
exactly,
it really changes the culture. You embrace the team, create leaders out of them.
Yep, they'll step up.
Yep.
Well, Cris, thank you very much. Regan, closing thoughts.
Thank you, Cris, for all of your bravery, and thank you for all of the mentors that you've had along the way that have led you to sharing this with the world. It's an honor to be in the echelon that is you, to be at that level. And for everyone listening, whatever you got from this, even if it's one reflection point, you're moving that dial towards shifting the paradigm. And that doesn't happen without you, Cris, and leaders like you. So thank you so much for being our guest. Thank you for listening to another episode of Everyday Practices Podcast. Chad and I are here every week thanks to our community of listeners just like you, and we'd love your help. It would mean the world if you can help spread the word by sharing this episode with a fellow dentist and leave us a review on iTunes or Spotify. Do you have an extraordinary story you'd like to share, or feedback on how we can make this podcast even more awesome? Drop us an email at podcast@productivedentist.com. And don't forget to check out our other podcasts from Productive Dentist Academy at productivedentist.com/podcasts. See you next week.